Now here's our reporter Laura Windsor with more on cancer and children.
Childhood should be filled with laughter and limitless possibilities. But for some children who are faced with cancer, their lives are turned upside down. We spoke with Dr. Elber Camacho at Desert Regional Medical Center in Palm Springs and asked him about the newest breakthroughs in cancer treatment for children.
Cancer in children can be divided in those related to the bone marrow, like leukemias and lymphomas, and those related to the central nervous system and kidney. Those are the major categories of cancer in early childhood. It is not that prevalent in children, but overall is one of the highest causes for mortality in childhood.
How do children usually get these types of cancer?
Most children cancer are thought to be an arrest in fetal tissue. As the brain was developed, as the bone marrow was developed, or the kidneys being developed, a tissue does not progress normally and stays in the body, and then later on, after the child has been born, becomes cancerous. That is most likely the major theory for the development of cancers in early childhood.
Are the treatments for cancer the same in children and adults?
In general, it's the same tools, but for childhood cancers, they need to be extremely refined for the specific cancer. It is terribly important that in childhood cancer, the child be treated in a major center because since it's relatively rare, most communities do not have access to the level of expertise that is needed for the treatment of childhood cancer. The hero in the treatment of childhood cancer is the child. These children, when I see them, even though I do not treat childhood cancer, but when I see these patients, I admire how rapidly they develop and how sophisticated and grown up they are. I also admire, of course, the family that has to deal with the child, and they need tremendous support. But I think also the staff, it requires a unique type of individual, both from the physician to the nurses to the therapists, to deal with childhood cancer. I truly admire the work they do. Overall, even though children suffer a lot in the treatment of their cancer, they are incredibly resilient. So they survive surgery very well. They can be treated aggressively with chemotherapy, even in higher relative doses to an adult. They can tolerate even higher doses of chemotherapy. So there has been great success and great strides in curing most kinds of childhood cancer.
Because of major advances in cancer treatment, more children treated for cancer are now surviving into adulthood. But parents should be sure that their children have regular medical checkups and watch for any unusual signs or symptoms that do not go away. For the American Health Journal, I'm Laura Windsor.